And here's one from Virginia. I'm finding a lot of the white rubbery clots and have been taking pictures of them, but it's become the new normal. I don't use a drain tube anymore because of all the clots. Blood clots and fibrous white ones. My angular forceps is my go-to instrument to help remove them. And so I'm thinking about that last comment from Canada, and I said, so is the Canadian embalmer in the above thing, is he calling the guy from Virginia and the other 249 embalmers that responded to the survey this year that said they saw the white fibrous clots? Is he calling all 250 of those people liars?
So, presumably this Canadian respondent was in the category that he hadn't seen any. He filled out the quantitative data as well.
Right. So I'm assuming he filled out the zeros when he said, did you see the clots? He would say no, and then what percentage of corpses he would record a 0 for percentage of corpses.
Strange that he saw none and others are seeing such high percentages. That's hard to explain.
It is, isn't it? And it is hard to explain. It is, and that's why I think we need further investigation. When I take in the data, Dr. Campbell, I assume that all the embalmers are responding honestly. I don't see why they'd want to lie about something like this. It's a serious issue. So I take every response I get, whether it's a pro or a con. I take the responses and I report them as they were told to me by the embalmers.
Well, you wouldn't be a researcher if you didn't do that, Tom. You can't just report the bits you find appropriate.
Exactly. You
have to report the lot.
Yep. Next slide.
Yeah. New York.
Here's an embalmer in New York. I've seen the clots vary from case to case since the COVID shot came around. We had many young deaths, 50 to 60-year-olds, with massive heart attacks, and every one of them has had clots, as discussed in this survey. Seems many people just want to turn a blind eye to it. It's all a shame. Yeah. As someone who's been around this for about 12 years, I've never seen anything like this. And this, most of these embalmers, as we talked about in our last survey, have about 15 years of experience on average. Many of them have 20 to 30 years of experience. Yeah. So they know what the blood looked like, well before the years of COVID and the vaccines. Absolutely. And they know how it's changed.
It'd be so interesting to know what blood vessels the blood clots were in. Were there actually blood vessels in the coronary arteries? I mean, we've no way from telling this, but
we have a little bit of insight from the People's Blood Clot survey that you and I went over about a month ago. When we asked the question about where in living people the clots are being found, it's hard, like you say, in the embalmers because the clot's being flushed out at the injection.
Yeah, it's being washed out, yeah.
But in living people, the number one answer was legs, deep vein thrombosis. Number 2 was lungs. We've seen a lot of pulmonary embolisms. Number 3 was brain. Number 4 was heart. And then we had a catch-all for like eyes, nose, uterus, other areas of the body. So that's where the people, at least in the living, the clots seem to be going. So,
Ohio.
The past few years, I've seen a significantly larger percentage of clotting in almost all embalmings. These white fibrous clots are definitely unusual, having never seen them before 2021. Although not seeing the white fibrous clots or microclotting in a larger percentage of the deceased, the number of grape jelly clots has significantly increased from the years past in all decedents. So, I'm from Ohio, Dr. Campbell, and I'm going to actually tell you a little bit of a personal story here. This last Tuesday, I had to attend a funeral for my cousin. His 24-year-old daughter died, Dr. Campbell, with a brain aneurysm. Yeah.
Terrible.
Now, he had told me that she had not taken the medical intervention. But as we know that the spike protein is not just capable of helping form these white fibrous clots and the microclotting, but also as you had a discussion, I think, with Dr. Sultan some months back.
Yeah, we did.
There's the issue of vasculitis as well, the weakening of the walls of the vessel being caused by the spike protein, regardless of the source of the spike protein. So, it's possible. We can't say for sure, obviously.
Yeah, we would need a cohort of pathologists' reports to adjudicate that properly. I mean, you certainly can get fatal cerebral aneurysms in people of any age. I mean, I could have one and die today. Sometimes you simply don't know.
I looked it up in the United States here. We have about 30,000 brain aneurysms per year in the United States.
Yeah.
And that sounds like a large number, right? But in a country of 300 million people, That's actually only 1 out of every 10,000 people a year having a brain aneurysm.
Yeah.
And in her age category, somebody from 20 to 30 years old, it's only about 1/10 of that. So her odds of actually having a brain aneurysm was about 1 in 100,000. I just find it hard to believe that she beat the odds, or she was the unlucky one out of 100,000 people to get that. I suspect that there may be something more at play here that may be spike protein related that's causing, like I said, vasculitis, clotting, etc., that can cause these. And even the father himself said that in their small circle of friends, there's been 3 young people that have died within the last 4 or 5 months. In fact, one just before our Thanksgiving over here, just about a month ago. So this is highly unusual, highly unusual.
So from that information, we can't really say anything about the cause, but it's, but we send our most extreme condolences to the family. It's appalling.
Yes, yeah, it was touching, and I was crying, he was crying, and it's just sad. Yeah, it's a sad thing. Terrible. And one of the things I want to implore young people to do is, if you have taken the vaccine, tell your parents about it, because a lot of people, parents may not want their kids to take the vaccine, but then the child takes it because they need it for a job, or they wanted to travel, or they wanted to do volunteer work or something like that. And then if something does happen, God forbid, then it would be good for the parents to know, because Richard Hirschman has told me he has on more than one occasion, families of the deceased thought that their loved one who died was not vaccinated, but then later on they went through their belongings and they found their vaccination card. So I think it's important for your loved ones to know your status, whether you have taken the vaccine or not. I think it's important for your loved ones to know your status. So, okay. Next one.
So this is Idaho.
Idaho. Sometimes I'm given the information about if someone has had a certain vaccine. Sometimes I'm aware that they've had 5 or 6 doses of it. These are the people we are seeing with abnormal clots or a significant amount of clots. That pretty much speaks for itself. Here's one from Florida. I've seen both types of blood clots, and definitely seeing the white fibrous clots in larger numbers as time goes. These clots range anywhere from 3 to 6 inches in length, with lesser outliers in both directions. Although I do see the grape jelly and coffee, they present themselves in a much smaller number. I've been performing approximately 100 to 150 embalmings per year for the past 4 years. I presently work with 5 other embalming funeral directors who have had very much the same experience. So that's telling me, again, he's saying they're talking to each other privately about this.
But this appears to be typical in his experience.
Not in public. And also there, he actually said something that was opposite of what the other embalmer said a few slides ago about he's seeing the grape jelly clots in less of his people. So that just tells me that, different embalmers are seeing different things. Some are seeing the clots, some are not. Some are seeing increases, some are seeing decreases, depending on where you're located. Next slide.
Arizona.
Can't believe we're still talking about this. It's a total scam and conspiracy theory. Blood clots are caused by refrigeration when bodies are moved in and out, repeating or refrigerated for a long duration before embalming. So he's saying this is all a hoax, and that the 250 that said they're seeing the clots, or if anything, it's a refrigeration phenomenon post-death.
But they have been seen in fresh bodies, and the white clots weren't seen prior to 2021.
Exactly, and in living people as well, according to my couple of whistleblowers. So,
well, we haven't got anything definitive on that.
That's right. I know the names.
But the data we have here is definitive. That's why we want to.
That's right. Yeah. And if you look at the next, the guy in Florida, right below him says, with many embalmings I have seen these clots in, I have had to inject in multiple points.
Yeah, to flush out the circulatory system. Yeah.
Right. Yeah. Both with cases refrigerated and prep done within a couple hours after death.
So that kind of contradicts, Florida kind of contradicts Arizona there, really, doesn't it?
Exactly. The next Florida guy says, seems like traditional chicken fat clots are frequently being replaced with jelly, fibrous, and microclotting. So this is also contradicts another debunking attempt by the naysayers that say that, hey, these white fibrous clots are actually just chicken fat clots. You can see this guy from Florida here, the second one, he's saying, no, chicken fat clots are one thing, fibrous clots are something different.
Yeah, the chicken fat clots are just like fat. You can put your fingers through it, but just
That's
spread
correct.
it out between finger and thumb.
Yes, they're small, they're yellowish in color, and they tear very easily. Much different than
whereas the white fibrous clots are completely different. They have tensile
they're
strength.
large, whitish, tough, and rubbery.
Yeah,
hard to break. So,
Yeah.
Iowa, very thick and large. I've had some of the whole diameter of the arteries and longer than a foot long. So this goes back to what you said in our last interview last year, that a lot of these turn out to be like a cast, right, of the vascular system.
Yeah.
Because you see the main artery and channel.
You can see the shape of the.
Right.
There were some examples last year where you could actually identify the artery it was taken from by the shape.
Yeah, exactly. You can see the tributaries running off of it. Yeah.
Yep. Mm-hmm.
Next slide.
Louisiana.
This is our last slide here.
Yeah.
Louisiana. Some of these fibrous clots come out as a whole, if done carefully, that mimic the arterial system, just what we were talking about.
Yeah, like a casting thing, yeah.
Exactly. These clots are clearly the cause of demise of the decedents, but were legally labeled as heart issues, which are not typically autopsied to fully determine actual cause of death. So what he's getting into here is the question of, are these deaths being recorded properly, or is the proper cause of death being listed on death certificates? So,
Important question, yeah.
and I'm in touch with
And given that less postmortems, less autopsies are being done, how many diagnoses are being missed is the other question in my mind.
Right. And the next one kind of goes along with that. He says, I've had several cases in 2020 to 2023 of the white fibrous clots, and most have had COVID listed as a factor on their death certificates. However, in each case, the family did not know if the decedent was vaccinated.
Yeah.
So, but I do know, Dr. Campbell, there was a monetary incentive to list COVID as the cause of death. Here in the United States, for example, I believe families got around $13,000 that they could apply to the funeral of a loved one if that death was coded as COVID. And we know hospitals made money when deaths were coded as COVID. We know the funeral homes are they know they're going to get paid for the funeral if the death is listed as COVID. So to me, there was a lot of incentive out there to list deaths as COVID when maybe there was something else that was at play here.
And the risk of overdiagnosis from the oversensitivity of the PCR test sometimes.
Right. The very last comment is from another Florida embalmer. Unusual clots has changed since COVID vaccine. I only took 2 Pfizer, refused to take booster nor vaccine again. And we've had multiple comments like this from other embalmers. They themselves see what's going on and they're scared.
Yeah.
So, I saw one of your recent videos, Dr. Campbell, that you talked about integrity or the lack of it with our public officials and how they need to step up and do a better job.
Yeah,
I'm asking
standards in public life, the Nolan principles.
Exactly. I'm asking the funeral directors, embalmers, vascular surgeons, cardiologists, endovascular specialists to do the same thing. To step up, show integrity, let us know what you're seeing or not seeing in both the dead and the living. Because this is important, right? These people are the only ones that see what's going on inside veins and arteries. So if they don't tell us what's going on, we don't know. We're in the blind.
It's true. Yeah. The embalmers are, in a sense, the guardians of the vascular system in death.
Right.
Yeah,
exactly.
Because otherwise, it's basically not looked at. And
I also want to make a plea to the media people as well. About 3 months ago, I actually traveled to Hershey, Pennsylvania, and I met Tucker Carlson at Hershey in person, handed him a vial of the clots, also handed his producer, Samantha, a vial of the clots as well, and asked them to please put me on their show to talk about this very important topic, especially since we know that a fourth of the corpses seem to have the microclotting and the white fibrous clots in them. So I have not heard from them yet, but I implore them to put me on their show as well. So if you can do anything, get with your friend Russell Brand or any contacts you have, Dr. Campbell, I would appreciate that because we need to get this out and you've done a terrific job. Our video that we did last year, interview together, got 2.1 million views, and it's got over 27,000 comments to that video that we did earlier this year about the results of last year's survey. So I can't thank you enough, because that was probably the major vehicle for getting this information out there.
No, you've done all the survey work. You've done the legwork on this, Tom.
Well, and it's important work because, like I said, we're seeing the clots in such prevalent numbers, and then we know that Big Pharma is not stopping. Moderna recently got approval for an RSV vaccine that's mRNA based for the elderly. Now, what's interesting is they just failed to get it approved for infants because it did so poorly in the trials. So if I was a person that was an elderly person, I'd be a little nervous right now if I've taken Moderna's mRNA vaccine that was approved for me, but not for infants.
Yeah,
so,
let me think if I'm going to get it. No, I'm not.
And, they don't just have that plan for us. They have shots for the shingle, bird flu, regular flu. Moderna's got about 40 of these things in the pipeline.
Big plans.
Yeah.
New factories all around the world.
And a scientific team that myself and Richard Hirschman have been in contact with believe that there's strong evidence. They're still working on it, but they believe that the spike protein is not only a problem, but also possibly the lipid nanoparticle is a problem as well.
Yeah, the lipid nanoparticle itself, and the fact that it's a different, suppose it's respiratory syncytial virus, mRNA vaccine, for example. Okay, the spike protein is probably particularly toxic, but the point is we know the systemic distribution of the lipid nanoparticles, and then you will get a cell expressing RSV antigen on its surface, respiratory syncytial virus components on its surface, and as a result of that, the lymphocytes will destroy that cell wherever it is. So we don't want foreign proteins popping up on the surface of our cells in our coronary arteries or cerebral arteries.
Correct.
So the actual spike protein, maybe it's particularly bad, but any vaccine, inverted commas, genetic preparation that causes antigen to appear with systemic distribution that is going to attract the attention of killing cytotoxic lymphocytes, to me is a bit of a suspect idea.
And the team that we're in touch with also believes that the phospholipid nanoparticle, at the moment that it actually opens up to release its modified RNA payload, maybe actually it exposes then its phosphorus heads that are in the phospholipid nanoparticle. We believe that has a negative charge to it. We believe it may be having an affinity for our natural fibrinogen that's produced by our liver, that protein that's important to the clotting process.
It could be causing blood clots.
Yeah, it could be causing this strange polymer, these white fibrous clots, as opposed to letting the fibrinogen convert normally into fibrin. And there's been various tests that they've done that they're pointing to that. They did an ICP-MS analysis recently.
I haven't got a clue. What is it?
S stands for inductively coupled plasma mass spectrometry analysis.
Oh, so basically, it's an analysis of the blood plasma, right?
Yeah, it identifies the elemental composition of the sample in terms of the periodic table. And what they did is they sent samples of the white fibrous clots to 2 different universities, and they verified what Mike Adams, the health ranger, had found in his analysis several years ago, that there was very little of our natural blood elements of magnesium, potassium, and iron in the white fibrous clots.
Quite a lot of amyloid protein.
Right. Yeah.
Pathological protein.
Yeah. Normal blood, for example, contains 450 parts per million of iron. In the clots, it was only 20 parts per million, much less.
But you'd expect that because they're white. If they contain the iron, there would be a rusty colour.
Exactly. Now, to the contrary, so we know it's not blood coagulating. Is what the conclusion there is. What they did find was high amounts of elements like potassium and tin and sulfur, which is very interesting. In normal blood, for example, phosphorus is only about 100 parts per million, but in the clots it was 5,000 parts per million. So what the lead scientist did is he went back and looked at the ingredients to the medical interventions, and he saw that they have in the lipid nanoparticles, they are, like I said, phospholipid nanoparticles. They contain large amounts of phosphorus.
Yeah, well, all cells are phospholipid bilayers, so anytime you got disruption to the cell membranes, that would make sense.
Right, and ATP, for example, right, is phosphorus.
Well, ATP is inside the cell. It's inside the cytoplasm of the cell, inside the cytosol, whereas the phospholipid membrane surrounds the outside of the cell, and indeed surrounds the nucleus of the cell.
So, but that led him to a theory that he thought maybe at the moment, like I said, the lipid nanoparticle is opening and those phosphorus heads are exposed, that it could be binding with our natural fibrinogen. So instead of converting properly into fibrin in a proper clot, it's being basically turning it into an amyloid, a misshaped or misfolded protein, right? That then becomes hard to break down. One of the things that led them to believe this, Dr. Campbell, is they did another analysis called an HPLC analysis. It's a high-performance liquid chromatography analysis. This basically identifies the amount of compounds in a sample. And, fibrinogen in its liquid state, when it combines to become fibrin, you can think of it basically as three ropes. There's an alpha, beta, and gamma chain that are smaller ropes, and they intertwine to form a stronger rope of fibrin. Well, and that's usually in a 1:1:1 ratio. But when they examined these white fibrous clots, they didn't find that ratio at all. They found the fibrinogen beta chain in 36% of the white fibrous clot was the fibrinogen beta chain. 16% of the white fibrous clot is the fibrinogen gamma chain, and only 4% is the alpha chain.
So it's very strange fibrin then.
Yeah, so what that is confirmation to them that something's happening and altering the normal process of fibrinogen converting to fibrin. That instead you're getting this bizarre polymer with instead of a 1:1:1 ratio, you have basically a 9:4:1 ratio.
Well, let's hope this comes out in the peer-reviewed literature pretty soon, so we can make a more objective evaluation. But there's certainly some interesting hypotheses there that we hope the biochemists are working on.
Well, the last test they did, Dr. Campbell, is what's called a thioflavin T test, and that tests for amyloid, the presence of amyloid, and they also did a Congo red staining as well. But they did this. Thioflavin T is thought to be more conclusive, and they recently did a test on the white fibrous clots on that, and did find under a fluorescent microscope that it lit up green, which is an indication that the clot material is indeed amyloid protein, misfolded fibrinogen, possibly aberrant proteins from that the other theory we've talked about in the past, the frame shifting, the ribosomes misreading the modified RNA and creating these nonsense proteins as well. So we think that the clots may be composed of these, and that actually dovetails very closely with Dr. Risa Pretorius' work in South Africa. She has several papers published where she has confirmed through thioflavin T testing that the microclots are made of amyloid material. So we weren't surprised to see the white fibrous clots, which we think are just macroclots.
That's surprising because the dirty blood clots, the microclotting, are red.
Well, we think at some point that the iron that's in there, that the red corpuscles that may be trapped in there, kind of condense out of the clot. And not all the clots, if you notice, are totally white either. Some of them are kind of tan in color or kind of pinkish in color. So they may contain some red blood cells that are trapped in there as well. But what's interesting, like I said, is her microclotting thioflavin T test detected presence of amyloid. So we were not surprised that the thioflavin T we ran on the white fibrous clots also detected amyloid material.
I think the important thing is that these white clots are available. The embalmers do have samples of them, and pathology laboratories are free to ask nicely.
That's exactly where I wanted to go with what you're saying. This team was a kind of an unprofessional, put-together team of polymer chemists and others, but there's no reason that universities out there can't do the same test that we're the
go to your local embalmers and say, "Please, sir, can I have some of your white clots?"
Yes, absolutely, Dr. Campbell. So that's all I'm asking for. I would like to see universities and the authorities do these same type of tests and see what kind of results they get. We think
publish in definitive peer-reviewed journals, and then we could put it on the channel.
Absolutely,
we'd have some firm data to base it on.
Exactly. Yep.
Tom, thanks for all your hard work. Is impressive. What's the next stage?
The next stage is report the results of this survey to the CDC, NIH, and FDA. I'll probably report it twice, Dr. Campbell. I'll probably report it in the next week or so to them, but then I'll also resubmit it in late January or early February after the new administration's taken place, just to make sure that the information gets to them. Because, like I said, I've been disappointed the last 2 years. The FDA, CDC, and NIH have never responded to these embalmer surveys. So I want to make sure that the next administration gets it in their hands.
Yep. I'm optimistic that we're going to know a lot more next year than we do this year. But for now, Major Tom Haviland, as always, thank you for your hard work and thank you for coming on.
Thanks, Dr. Campbell.